was a kind of difficult time. बेबी का वेट नहीं बढ़ रहा था, बहुत जरूरी था वेट बढ़ाना. So issue was like blood was not flowing properly, and that is why baby is not getting nutrition, and that is why baby is not growing. And she was directly saying, just take this baby out. We have to take this baby out. I just left that hospital. Actually, I did not felt baby moment. It was very heartbreaking. I started crying. Why my baby is not moving? Parents, do not scared. If any problem come to your pregnancy, always be positive. Don't stress yourself. If you will start stressing yourself, you can make the case more complicated. Hello friends, welcome to my YouTube channel. My name is Karishma, and in today's video I am going to discuss about blood flowing issue during your pregnancy. I have personally faced this issue while I was pregnant with my first kid, Mitansh. He's a boy and he's perfectly fine now. So what are the difficulties I have faced and what are the solutions which I take for precautionary, like for the precaution? This is what I'm going to suggest you in this video. So this video is going to be very helpful for you. If you are new here, subscribe my channel and also press the bell icon so that you will get notification of my each video. So without getting any further ado, let's get started. So I would like to start from the anti-scan. If you are pregnant, you must know that what is anti-scan. What anti-scan is. This is the kind of scan which usually performs during 12 weeks of pregnancy and after completion of 3rd month, you can say. And in this scan, you will get to know a lot of things about your newborn, and it's a good time to see your newborn. Actually, he has completely developed by this time, like hands, tiny legs and everything. They check the spinal cord, especially they check the fluid area around the neck so that they can guess whether the child has any abnormality or Down syndrome or not. And then they correlate the same scan with double marker. So that's a different thing. I'm going to talk about only the blood flow issue. So yeah, in this anti-scan, doctor has revealed that Karishma, you have this blood flow issue. And what is this blood flow issue? Let me clear you. What is blood flow? Blood flow is like through the placenta where the baby get all the nutritious food you eat. So this is a kind of flow, and this blood flow should be like normal. But in my case, it was not proper, and due to that, there was the chances like have a low growth rate, you can say, like the baby will not grow properly if he will not get proper nutrition. Obviously, if somebody is not getting proper nutrition, how he will supposed to grow properly, right? So it was a concern raised by the person who did my ultrasound, and he clearly said that there is a issue of like blood flowing issue, but the problem is like very small. So after, if you will consult with your doctor and you will show the reports to them, they will surely give you some solution of that. Then I consult the report with the doctor. You can see my first report. I'll attach all my reports here, like first, second, third, whatever the scans I have, I'll upload all the scans here. You can see clearly the reports. So I consult with the doctor. She suggested me one EcoSprint medicine for thinning the blood so that it cannot create any issues. I started taking them, and in the 5 month when I had the anomaly scan, in that scan again I found that blood flow issue. And where it is mentioned, let me clear you. Look, this is the SD, left artery, right artery. मेरे left में था issue जो था last time. बढ़ा हुआ था ये. It should not be like this. The ratio should be below some proper point, but मेरा ज़्यादा था. So at the time like 5 month when they see the like baby is not growing properly, and weight is also less. The weight is not appropriate by the time. And then she increased the dose of EcoSprint. Like you can say she increased the mg. Earlier I was taking 90 mg or 75 mg something. So 75 mg, yes. Earlier I was taking 75 mg EcoSprint, and after that she increased the mg. In the 7 months when again I have performed what scan do we call? Growth scan. Again the same issue was like, again doctors found the same issue. It was not going even after taking the medicine. So this was a kind of difficult time. Baby का weight नहीं बढ़ रहा था, बहुत ज़रूरी था weight बढ़ाना. उसके लिए doctor suggested me to take some protein bars. I'll discuss the solution at the end of this video. First of all, I want to share the issue. We'll discuss the solution in the coming part. So issue was like blood was not flowing properly, and that is why baby is not getting nutrition, and that is why baby is not growing. So what you can do in that case, that I'll discuss in this video. So my doctor suggested me to take out the baby at the 7th month, and we will put him in an ICU and we'll take care of it. I was so like stunned. this should not be the answer, like directly. Doctor has no sympathy at all, and she was directly saying, just take this baby out, we have to take this baby out. I just left that hospital. Actually, I was in Delhi that time, Faridabad actually, not in Delhi, and that was Batra hospital. I left that hospital, and I again consult 2 or 3 doctors, not getting any satisfactory answer. And then there is one hospital, Madhukar Rainbow's Childbirth. It is in Delhi, and it was like new that time, and it was an amazing hospital. Finally I found a good doctor who, you know, she's just an angel for me, because I have a normal delivery, and it's because of her. So yeah, I met with her in the 7th month of my pregnancy, and she suggested me to have some. Yeah, now I'm going to talk about the solutions, how you can increase the baby weight if it is not increasing due to blood flowing issue. You have to eat some protein bars. They are available in the market for especially for the pregnancy period. And also she suggested me a protein powder. I have to mix it within like milk, and have to drink it daily. And other than that, she suggested me the protein rich diet, including like paneer, milk, chaach, this kind of diet she suggested me. I did all these things to gain the weight. Not me, but my baby should gain the weight. And along with that, she performed my scan every week. From the 7th month I had like so many scans, because every week I have to go for a scan. It's a kind of color Doppler. We love to see our baby. I'll put the pictures of my baby here. You can see that, like when 7th month. So yeah, she was saying like every week there was a little growth happening, even though the blood flowing issue is there, but the growth is also there. The growth was not stuck. So she decided not to take the baby out. Instead, she gives me injections for maturing the lungs, so that if in any case, if any emergency occurs, in that case at least we can take out the baby. So she gives me 4 injections for the maturity of lungs, and I took them. There was no such issue. And after that, like when my 7th month passed, 8th month passed, 9th month started. And you know what, the 9th month started, I did not felt baby moment. It was very heartbreaking. I started crying. Why my baby is not moving? Why my baby is not moving? I did not feel anything for a day. I rushed to the hospital. I asked her. She immediately took ultrasound. In ultrasound, baby was also not moving. They also get scared, but they check by performing some, I don't remember the name of that. Actually, it's been a long time. They put some machine and they check baby is happy inside or not, and as per their reports the baby was happy. But still, because of movement are not there, she asked me to deliver the baby. It's like 8th month, and 3 days or 4 days up, I was admitted to the hospital on the same day, and then she gave me those injections. But to give fake pain induce. Then they give me injection for like induced pain, and at night they used to give me like 2. At night they have given me I think 2 or 3 injections, and by the morning I started pain, and you know the baby was delivered normally at 11 o'clock. So yeah, all journey was very difficult. But one thing which I have learned from this is like even if doctor is saying something, it's not 100% true. Sometimes it's not at all 100% true. You have to be, you know, particular about you have to be self-belief that time. You have to be strong that time. You have to be confident that time, and don't give up. Actually, you should not give up. If one doctor is saying something, you should always consider, you should always take second opinion, or sometime if it is required, you can go for the third opinion. I think I consulted with 3 doctors, and it was the 4th doctor which I really like, and you know, go for the treatment further. So it's a kind of like a good experience, because even though if you're told by the doctors that you should take out the baby premature or something, my baby was perfectly fine. Obviously the weight is still low. At the time of delivery it was showing 2.3 on papers, but when he came it's like 2.1 kg something. So it's very low. But you know, after coming out, I gave him some good things. and my baby grew properly. Like within a month he gained the same weight which a 1 month baby should have, and till the 10th month I've always focused on his weight and it was properly fine by the till now. Everything is going good. So this is my experience. Do not scared if any problem come to your pregnancy. Always be positive. Don't stress yourself. If you will start stressing yourself, you can make the case more complicated. So it's better not to take stress. Be patient, be calm, think positive. Do not feel negative about that. I have never felt anything negative until the moment stop. Even though that time I did not think in a negative way, I just rushed to the hospital directly. I did not wait for 1 day, 2 day, 3 day. Few hours I've noticed that I'm not having any movement and I just start feeling scared and I just went to the hospital. So there is like, you should always be aware about the things. You should always be aware about the things. It's really important. It's really important during pregnancy. So this is it for today. We'll discuss new story next time. So yeah, this is it for today. I would love to share my story with you. It might help you in your case, and thank you so much for watching me, guys. And if you watched this video till the end, thank you so much. Please subscribe my channel and share it with your friends. It might be helpful for somebody else. Thank you so much for watching. Bye.